Hello everyone. Before we begin, let me ask you something. Have you ever searched your symptoms online and within a few minutes convinced yourself that something is seriously wrong? Be honest, because I think most of us have done that at some point, right? But if you really think about it, what you find online is mostly general information. It doesn't actually know what's happening inside your body. And when it comes to something as important as your health, guessing is not an option. We need something more accurate, something that can actually show us what's going on inside. Welcome back to the podcast where AI meets medicine. This is episode 2, and I am Kuhu Chandna, currently pursuing my BTech in Artificial Intelligence and Machine Learning. Someone who is genuinely fascinated by how AI is reshaping the world, especially in medicine. So, in the last episode, we talked about the bigger picture, how AI is slowly entering healthcare by helping analyze huge amounts of medical data and completing tasks in seconds that would normally take humans hours. But that was a broader view. Today, we are going to zoom in on one very specific space, a place where decisions are silent, but the consequences can be incredibly loud. And that space is radiology. AI is not just assisting anymore. In some cases, it's actually challenging human expertise. The first question that comes to our mind is who exactly is a radiologist? These are the doctors behind the scene, the ones who don't always meet you, but whose decisions can completely change your life. They specialize in reading medical images such as X rays, MRIs, CT scans. Basically, they look inside your body, but without any surgery. And they detect problems like fractures, tumors, infections, sometimes even before symptoms appear. You can think of them as silent detectives of medicine, except instead of solving crimes, they are solving medical mysteries happening inside you. And honestly, if you have ever seen an MRI or a CT scan, you probably just look at it, nod a little, and pretend you understand what's going on, right? But to them, those images are not random. These are the stories, the warnings, and sometimes they are the answers waiting to be discovered. Now, here's the thing, radiology is not just about reading images, it's about recognizing patterns in situations that are not even perfectly clear. Most scans are incomplete in some way or the other, like blurred edges, overlapping structures, natural variations, and many more. So it's not like a perfect HD picture. In fact, it's often confusing. And yet, from this imperfect information, they make critical decisions. A radiologist doesn't just identify what is visible, they interpret what is uncertain. They combine the patient history, symptoms, probability, experience, and sometimes even intuition. That small feeling of something is off here only comes with experience. Now let's bring AI into the picture. Because AI looks at the same problem, but in a completely different way. AI does not understand in the human sense. Instead, it learns patterns, statistical patterns from massive data sets. Systems trained by organizations like Google Health analyze millions of labeled images and learning connection between patterns and diagnosis. So when AI looks at a scan, it's not thinking like a doctor, it's predicting. No doubt, no hesitation, just calculation. And in many cases, it's doing that incredibly fast. And this is where things get interesting. Because in the end, both radiologists and AI are trying to answer the same question. And that is, what's actually wrong with the patient? But they do it in completely different ways. AI works with data and patterns, whereas radiologists works with context and understanding. But sometimes they don't fully agree. Now let's move beyond theory. and talk about something that surprised doctors themselves. A team at DeepMind was working on normalized scans. Nothing dramatic, no emergency cases, just regular retinal images. The kind you take during a basic eye checkup. But then, something unexpected happened. The AI didn't just analyze the eye, it started picking up patterns in the blood vessels. Tiny variations, things so subtle that even trained ophthalmologists wouldn't normally focus on them. And when they studied it further, they realized the AI could predict a patient's risk of heart disease, not from a heart test, not from blood reports, but from an eye scan. Now imagine this. A patient walks in for a simple vision check. No chest pain, no warning signs. Everything seems normal, no? But behind the scenes, the AI flags something invisible. A silent cardiovascular risk. Something that could have gone unnoticed for years. That's not just assistance. That's seeing what humans didn't even know existed. Now let's talk about a moment we all lived through. The chaos of COVID-19. Hospitals were flooded, doctors were exhausted, and every second mattered. In emergency wards, patients were coming in with breathing difficulties, and doctors had to make fast decisions. Is this infection severe? Or does this patient need ICU support? Or how quickly is the disease progressing? Now, here's where AI stepped in. AI systems were trained on thousands of chest CT scans and X rays, and in real time, they could scan an image and highlight infected regions in seconds. That one insight could mean the difference between early intervention and a critical delay. So, in this case, AI is not just replacing the doctor, it's acting like a second pair of eyes that never gets tired. And in the next case, we are going to talk about early cancer detection. Let's take lung cancer. It often starts silently. No symptoms, no obvious signs. Just tiny nodules in the lungs, sometimes as small as a few millimeters. Now think about a radiologist scanning hundreds of CT images daily. Even the best experts can miss something that small, not because they are not skilled, but because human attention has limits. And we have to accept that. AI doesn't get distracted. It scans every pixel and it can flag these tiny nodules early when the cancer is still in its most treatable stage. Now imagine a patient whose scan looks almost normal, but the AI highlights a tiny suspicious spot. Further tests confirm it early and treatment starts immediately. The patient's survival chances significantly increases. That's not just detection, that's early intervention and potentially saving a life. And I think this is where AI stands out. Not because doctors are not skilled, but because the human eye can miss tiny differences. AI doesn't get tired, it doesn't lose focus. It analyzes every slice with the same attention. And in cases like this, spotting something that early can change everything. So, yes, AI is fast, and yes, it's powerful too. But this is only one side of the story. Because AI is not perfect. It performs extremely well when it sees patterns it already knows, but when something is rare, unusual, or slightly different, that's where things get complicated. Because AI depends on data. If something falls outside its training, it can struggle. And this is where radiologists still matter a lot. Because they don't just rely on patterns, they understand the patient, they consider context, and most importantly, they take the responsibility. Now, let's make this a little personal. Imagine you are sitting in a hospital waiting for your report. You know your scan has been analyzed, maybe by a machine or maybe by a doctor. But when the result comes, would you feel completely okay if it was only a machine's decision? Or would you still want a doctor to explain it, guide you, or reassure you? Because that human connection, that trust, AI still cannot provide. And in that moment, it's not just about technology anymore. And that brings us to the real answer. The future of radiology is not AI versus radiologists, it's the collaboration. A diagnosis is not just about identifying a problem, it's about making the right decision at the right time for a human life. So, the next time you walk out of a hospital with a report in your hand, just pause for a second because behind that one piece of paper, there might have been a machine scanning patterns at incredible speed and a human mind trying to make sense of it all. Maybe this was never about choosing sides because at the end of the day, it's not AI sitting in that hospital room and it's not just data lying on that screen. It's a patient, a real person waiting for the right decision at the right time. And if intelligence can help make that decision better, faster, and safer, then maybe that's what truly matters. Thank you so much for listening to AI Meets Medicine. I hope today's episode gave you a clear perspective on how AI and radiologists are complementing each other to improve healthcare. And maybe the next time you step into a hospital, you will realize how much is happening behind the scenes. I'll be back with another interesting conversation in the next episode. Until then, stay tuned.